Good evening, everyone, and thank you for joining tonight's webinar. Please be reminded that all microphones are muted throughout the meeting. And for comments, please use the chat box. And for questions, please use the questions box. Our speaker for tonight is Mr. Laurie Hawkins. He has been credited as the father of and advocate of the National Health Services Directory in Australia and facilitated the introduction of the National Health Camp. He has presented at HHIMSS Asia Pacific 2015, HIMSS Australia 2014 conferences, and the International Symposium on Data-Driven Healthcare, recently held in Singapore in August 2018, in Beijing, China, assisting the European Health Delegation and at EU Health Conference in Tallinn, Estonia last October 2018. Without further ado, we will now call on our speaker.
Good evening, everyone, and thank you for the opportunity to be able to show you some of the e-health initiatives which I've been responsible for in Australia and how they may benefit yourselves in the future, wherever you are. Basically, the first thing we're going to do is a PowerPoint presentation, which we shall get to first, and just give you a bit of an introduction of transforming data, which we have in abundance in healthcare wherever you are, but we don't seem to make use of it. I'm also a member of the ECH Alliance in Europe, and that involves China, Canada, and the US, and a member of the Digital Health Society, which was created in the European Union by Estonia during its presidency, and also a member of the Asia eHealth Information Network as well. So thank you for the opportunity. I'm going to give you a presentation which I gave in Boston to the Connected Health Conference some 3 weeks ago. And basically some of this is you already know, but the challenge is between jurisdictions or organizations, free flow of data. That is the fifth freedom in the European Union. Unfortunately, in healthcare, as you all know, free flow of data, interoperability, in 2018 is still not happening. You can go to a bank anywhere and it just works. You can go to an ATM anywhere on the planet and get some money out. So what's the problem? Everybody's doing lots of goals, plans, strategies. We spend lots of money and then they get put on the shelf. And we have the same old thinking with the same old results. Nobody is actually getting any good outcomes. Individual initiatives, fantastic, but we're not getting in there. And what's our problem? Aging population, poor health, chronic disease, arthritis, and a lack of money. And it can't be, it must be sustainable. Health must be sustainable. As you're aware, the US, the GDP on healthcare, I think, is about 18–19%. And when I was over there 3 weeks ago, everyone told me it's a broken healthcare system. It's unsustainable. Where is the problem? It's across the whole planet. And we still have thousands, tens and hundreds of thousands of data containers. Data containers. They do not interact, which is what we need to unlock. And we're not talking about patient records here. We're talking about the fundamentals to enable the patient record and that information to be transported. But let's get the fundamentals, which is what we've done in Australia. So how do we fix the problem? Two things. Strategy, let's do something now. And data. Do we make use of data? No, we do not as a whole. Allow me to show you how we can use that data, and we do in Australia. So I've been responsible for what's called the Victorian Human Services, which is in the state of Victoria, population 4.5 million. And by the success, we've eliminated 163 provider directories. Provider directories, as you know, are white pages or names of doctors, practitioners. Now it's been adopted by all states and territories in the federal government. And I've been responsible for getting all those people to agree some 6 years ago. And in 2012, the NHSD went live, which is some pictures on the left-hand side. What it is, it's a repository of health and social services or human services. Not only that, it brings in public, private, and not-for-profit all in the same directory. And we only need one API for all of the health ecosystem, from aged care, dental, acute, primary health, mental health, to be able to come and grab the information. 9.5 million transactions and searches every month, and increasing every month. What we have, interoperability across organizational and jurisdictional borders. That can be state borders, it can be international borders, it doesn't matter. All from the cloud. And as a result of all this national data set, we can now link it with census data, hospital utilization data, and everything else, which I'll give you a demonstration of, just a few examples. So this is the Australian Health Services Directory. You have content providers who provide the information and practitioners all in the cloud. You have information provided to the whole ecosystem, hospital EHRs, mental health. I'm not going to read it. You can all see it. Not only that, we now have a foundation for secure messaging. Secure messaging is discharge summaries, referrals, pathology reports, because we store national identifiers and organizational identifiers and provider identifiers all within the National Health Services Directory. It supports call centers. The ones underlined are just a few examples. Here in Australia, we have a national 1300 number, free call, for people who have problems or they want to consult somebody, so they go to Nurse on Call, GP After Hours, all those that are underlined. It also supports the National Disability Insurance Scheme in Australia. It's $22 billion because people want to know where services are, not where people are, not health practitioners, where the services are. We also have the National Telehealth Directory. It's been agreed by all parties that we just have a single National Health Services Directory. The National Health Map, a tool using Google Maps, which enables you or anybody, you can gain and have a look at it. You can keep your data in your data center, and you can keep it secure if you don't want people to look at it, or you can share it. It's a Lego bricks. And I'll show you some examples. Smartphone apps. In Australia, on a smartphone, I can find a dentist, doctor, hospital service, but any service, anytime, anywhere, and the smartphone will use my location if I let it, and then I can add it and it will tell me how to get there or where I need to go. Nowhere else on the planet have I been able to find information on my smartphone, all from the one country. We have consumer portals, cancer service, mental health, aged care. Everyone takes a slice or a stake in the National Health Services Directory. Now we can consolidate this national data set with other data sets. We have an advanced visual data analytics platform, which does all these. I'm not going to read them out, but it has confidence indicators, relative error planning, and it also uses bar charts, not the traditional chloroform or heat maps. And we'll show you some of those as well as we go through. Now, you'll see in front of you data from 4 separate countries, all using the same platform. It is possible on a global scale or within an area such as Asia or Africa to do the same thing. Whether that's, as you can see, there's immunization in the top right-hand corner for the United Kingdom, 5-in-1 vaccine on the left-hand side using an ODA interface, county data, hepatitis B, and you can see by the bar charts where the worst problems are. Bottom left-hand corner, Australia, where all the GPs are physically located. Right-hand corner, waiting lists for hospitals. We can do all that on one platform. Why people don't utilize it anywhere else, I don't know. Not only that, we can get access to, in the top right-hand corner, this is Melbourne, and that's the urban growth area. So we can now see where all the houses are going to be built. And if you click on the bar chart, it will tell you how many houses are going to be built there. So we now need to know whether we need any doctors there or hospital beds, whatever. Not only that, we can do frog surveys. We can take video, pictures, anything. Also, because we're using Google Maps, in the top left-hand corner, we can see where all the railways are. We can see where all the railway stations are. We've put on planning circles in there so you can get an idea of how far you have to travel. Not only that, bottom left-hand corner, earthquakes. And we can say, over years, what strength they are, what damage they've done. There's a whole raft of different things, Lego bricks. What if we actually started to use it? And we better get up to the proper right. We shall now go. This is the Victorian Human Services. It's been around for over 10 years. Trusted and gets over 1.5 million hits a month. But allow me to show you. So if you want to find a doctor in the Melbourne CBD, and you'll notice it's been nationalised just for Australia, but this could be a whole range of countries or states or regions, whatever you have, it doesn't matter. Availability. We want to find a doctor in the Melbourne CBD after hours, but not only that, we want to find a female practitioner, and we want to find somebody who speaks Mandarin. And we can do a practitioner search, find an individual, or we can do a site search. So I'm going to do a site search for you. And what it will do is show all that category. And this just gives you the basic details. But if we go and have a look at one of these, and this is an old interface, but you can see here, this was when it was last updated. So it's updated every 6 months as a minimum. And we get site information, and you get a map, and you can slice and dice this data however you want, which I'll show you in a few moments. Services, what services does this offer? Melbourne City just offers GP services only. If there were diabetes services, podiatry, they would all be listed underneath there. And who are the practitioners? As you can see, these are the practitioners. If they don't want to be seen, they can have anonymous and they won't be viewed. And you've got all the various information. And not only that, if they practice at multiple sites, they will be listed down in the bottom left-hand corner. Now, I've been responsible for the success of the Health Services Directory, and it's gone. So the ACT government, another state in Australia, decided to adopt it. And this is their front end. And you can see this is their smartphone app. And however, so you can find practitioners, choose your language. As I said, it all comes from the Health Services Directory down here. So many different ways of slicing and dicing. Here is the National Health Services Directory, which is supported by all states and territory governments. As you can see up here, just 2 pieces of information. I want to find a doctor. I live in a place called Bendigo. I think 3550, and do the search, and we have what's called a widget, and it shows you all the ones that are here. Not only that, the ones that are open, you can change it up here, but not only that, we have all the ones that do home visits and also telehealth and phone support open now. So it doesn't matter, you can print them out, you can do whatever you want. The widget is very important because everybody can have the same widget in their website, regardless of where they are, customize it to what they want, and they never ever need to do anything else about it. And you can see Aboriginal health, but you can customize it to whatever you want to do. Embeddable widgets are just over here, but we'll leave that for the moment. This is a widget again for the Department of Health in WA, Western Australia. Same widget, and they can do more services, or you can type in keywords or suburb or whatever you want to do. Everything is done. So when you upgrade the widget, you upgrade it for the entire ecosystem, hundreds of websites or thousands if they've got it. Smart move. Not only that, here is Cancer Australia. This is a not-for-profit organisation, but down the bottom, they've taken that widget, and now you can find all these different categories, whatever you want to do, specifically for cancer, as you can see in here. Not only that, when you're doing doctor, you can do My Health Record, which is a national health record, telehealth capable. You can do anything, basically. Why more people don't come to this, I don't know, in terms of other countries. Now, because we now have a National Health Services Directory, which has 400,000 services in it, it is also the National Provider Directory, so it has 300,000 accredited healthcare practitioners in it. As I said, it's the National Health Services Directory, National Telehealth Directory, and it's the National Provider Directory. So it's a foundation block for national or e-health in Australia. Now, this is the health map, which takes all that data and enables you to start using that data. So I just very quickly want to show you some of the stuff that it does in Mapping 101. So as you can see in front of you, we'll just make this a bit smaller. Here we have all the markers. This is where every single GP physical site is in Australia. And because it takes the data from the National Health Services Directory, and the National Health Services Directory is updated on a daily basis, everything is as accurate and as current as you can get. It involves a call center. So zoom out, but if we want to zoom in, you can see how fast, and if we've just got one, there you are, university. If we go over to here, it tells you who it is, gives you their phone number, their website, service details, after hours, and the data set all comes from the National Health Services Directory. You can print it out, do whatever you want. Boundaries. Everybody does not use boundaries. Boundaries are very important for how you look at data. So this is the aged care planning regions. Everybody has different regions for different purposes. Home and community care, Indigenous regions, local hospital networks. You can see how fast they come up. Modified Monash is extremely difficult to do, as you can see, primary health networks and so on. Now, chloroform maps, traditional way of showing data. This is diabetes, aged 18 and over. And we can change this. This is quite easy to do. However, it's the bar charts. Now, what we can do is have data outliers, confidence indicators, inverse geo bars to highlight the smallest magnitudes of data. Now, what we're going to show you here at the moment is the ABS census. We have 3 censuses in this platform, which is the 2006, 2011, and 2016. So that means you can now start to see trends of where population are moving or whatever they're doing. Now, chloroform map. This is Indigenous regions of regional and remote Australia. Now, the challenge with chloroform maps or heat maps is you can't see these little red blobs where I'm just pointing to. However, let's turn them into geobars, and suddenly, visually, you can see where you need to spend your money. And you now get an idea of the population percentages, physical numbers. Now we'll go to the next one. Here is where all the GPs are across Australia, 7,929. If you want to see who's open on a Sunday, very quickly you can. Who wants to see open at 10 a.m? There you go. Anything with a 1 you can click on and you will get all the information, plus all the additional services that they offer, needle and syringe, hospital services, general dental at the same place, and also the facilities. If you want to see where all the pharmacies are with the same criteria, just click on there and there you go. If you want to see where all the podiatry, won't get many on a Sunday, but there you go. All very quickly and easy to do. Clear the map, simple as that. Now we will then go and show you some of the data and workforce. This is workforce. Notice in the top right hand corner, 2001, it can be 2000 and whatever. And this is over 402 locations. And you can quickly run and you can see where there are the most practitioners. Now what we're going to do is change the numbers. This is by local government areas. So what we're going to do is change the physical number of GPs to a population basis and see if that changes. And no, there's not much change in there. However, if we do it per 100,000, you can suddenly see where the highest and the lowest is. Now we start to add in other data as well. For example, here we have avoidable death from cancer. This was done, and you can see it's not very clear because we're quite out, but if we go up to here and if we go to New South Wales and the state, you can now see that is by local government areas. And these confidence indicators tell you A, how good the data is, and B, is it reliable? You can switch these on and off, show changes. We can change the group count, which is this over here. Let's change that to 10, show changes. There you go. And you can see which is the worst or which is the best, very simply. Now, if we do age standardized death ratio instead of per 100,000, there's not much difference. So at least you can do that. And you can see all these different breast cancer if you wanted to do that, clear that, show the breast cancer in physical numbers by local government areas or the equivalent of shires or counties. All we do is tick the box. There you go, traditional way, change that to that, and there's not much difference, except in Brisbane. So let's go back and we'll have a look at Australia, and you could see across there. Okay, next one very quickly. We have nurse triage. I mentioned earlier on about National Nurse on Call. These are the volumes for total from July 2011 to 2016. Using bar charts, traditional ways we would show by ABS. ABS data is used by the Australian Bureau of Statistics, and it de-identifies the data. And you can see, if we just move this over here, the most calls came from the ABS area 6210, and there were 26,000 calls or episodes, as they call them. If you want to change it to bar charts, there you go, and you can see them, and you can run them over, and it will tell you the same information. And if you click, you can see all the data, and you can look across, and you can print it out, open it as a PDF. Now, what I haven't shown you at the moment as well, which we'll get to, is how you can create your own maps. So you go to Browse, click any of these, click what you want, and this could be an international, for example, with cancer. This is just for Australia, but you could do cancer on a world basis or an Asia basis, and you can mix and match and do whatever you want. We won't load these at the moment. The reason I was going to show you is this is the same data, but we're going to change the way that it's been shown. Suddenly, your data looks completely different to what we're doing by primary health networks. And we can do Medicare locals, changes again. And we can do states and territories, which shows you completely different again. Not only that, you can add in all these different quarters. So you could just click on one of these, for example, and the data will then change for whatever it is that you've selected. Now, the other ones we'll show you as well. Let's have a look. What we have down here is service accessibility. Let's have a look, which we'll go to here. What I was going to also show you is telehealth capable services. So we can find all the ones across Australia, for example, with allied health, Aboriginal, diabetes education, dietetics, all across Australia. and we'll just leave that there. But what we will do is just click on dietetics, for example. So we're overlaying where everyone for dietetics can provide telehealth services. As I mentioned, it's a national telehealth services. Just click on the top. Not only that, because we now have all this services data, suddenly we can see where all the aged care facilities are and the services that are associated with that. Residential services and everything else. You can slice and dice and do whatever you want. Now, what I was going to do is what you have in front of you, we'll just get rid of dietetics, is here we have, just go back up. What we have is service catchment, service accessibility by catchment area. So what we've done is planning circles in a 50-kilometre radius from all hospital services across Australia. Let's change that to 100k, and suddenly you can see where they all are and how much they all cover. If we want to display the services, yes, we can do. And then we can go in and we can go to New South Wales as an example. And there you go, and you can see where all the coverage is. Not only that, we now just go back out. What I wanted to show you as well is because we now have census data as well, we just get rid of the services and we do it at 100 kilometers. But now for emergency services, so let's go and find hospital services. What we want to show is all the people that are able to visit these hospitals. So you can see that in Alice Springs, just move that down there, they have 37,000 people they look after as a population. If we wanted to change that, we can change to total males. Not much difference in there. Let's go to females as a percentage, or let's go to females. So you can see there's 18,000 females, and we can even do it as percentages as well. Suddenly shows you a lot more. And we've got Indigenous, birthplace, need for access. So what we're saying is you can now start to plan your services and even start to look at hospital utilization statistics, theatres, emergency episodes. One other one I'll show you is you can now create your own storyboard. So what we've created here is the map of 2018, very recent, workforce shortages. And workforce shortages have been used here in Australia to encourage people to actually go from urban centres and into regional centres. So here we have as an example, if it's in red, there's a shortage all across here, just the blue, the capital cities, wherever we are. So if we want to take Brisbane, for example, and want to find out the GPs, very quickly you can see that these areas don't have a shortage, but there are shortages in all this area. And what else can we do? We can then change and have a look at obstetrics, oncology, cardiology. Doesn't matter, you can do it for a whole country. You can do it on a global basis, have different criteria, but that is a big change. Okay, here's where all the physical locations are. So we have Oak Valley Health Community service in this large area, and Sejuna down here, and you can see everything else. If we now go to after hours GPs, we have a look at Perth, and all GPs in Perth, you can then see them. Anything with the one, it will show you. Same as all the other ones. There you go. But let's see who's open at 9 p.m. Not many. And who's open at midnight? Nobody. Who's open on a Sunday? There you go. Now what we can do, because this is a national database, we can now start to utilize GP data. So here now you can see per 100,000 the GP services from Medicare Benefit Scheme and Department of Veterinary Affairs in 2009 and 10. and you can see all the different how much they were per population. So they're they're pretty good. But however, down in Adelaide, in this particular suburb, only 263. Is that a more affluent area, or whatever reason it can be? We can now start to do a bit of studying. So I said I'd take half an hour. So I would like to invite questions, and if there's anything I can show anyone or tell anyone very quickly. Thank you.
Yes, thank you for that presentation and demo, sir. We would like to open the Q&A. So if there's anyone with questions, please type them in the questions box. We'll be waiting for your questions. Thank you.
Do we have any questions?
There are no questions, sir. Is there anyone with questions? Please type your questions in the questions box. If there are still no questions about the presentation, sir, and the demo, would it be okay if someone asks for questions after the webinar? Can we still refer them to you, sir?
Okay. Well, I was just going to say, if people are still there, is what you can actually do is utilize this data. So, for example, with the health and lifestyle, health services, if you want to see health services directories and just load that up, which is down the bottom, you can actually find a specific area, then go to view, and you can export that and put it into a spreadsheet if you want, and then you can put it into your business intelligence tool, Tableau, or whoever you use, Power BI, and you can do your own data in your own way wherever you want to. So it's a single source of truth for the whole country, or potentially for a group of countries, so you can all share the same data and now start to make use of that information and put it into intelligence. So very quickly. Thank you.
All right.
If anyone,
Thank you, sir.
if anyone would like the presentation or the PowerPoint, or get in touch with me, I'm more than happy to ask any questions afterwards. Thank you.
Yes, thank you. Anyone else with questions?
Now, can we can we re-review this webinar afterwards?
Yes, sir. We're actually recording the webinar, so those who missed the time slot can still review them.
How do we access that?
We'll be posting the recording in our website, if that's okay with
Okay.
you.
Thank you.
Yes, thank you. I think there are no more questions, so I think we can wrap up this session.
Okay, that'd be great. Thank you very much for allowing me to present.
Okay. Yes, thank you very much for your time and sharing your expertise to the AeHIN network, sir. Thank you and have a good night.
I will. Thank you very much. Thank you, everyone. Take care.
Thank you. Bye.
Goodbye.